Hi, I'm Andrea Swenson. I'm a project scientist with the National Farm Medicine Center. Today I'll be presenting a social network analysis of the rural firefighters delivering agricultural safety and health project. I'd like to thank my co-authors Kathrine, Kyle, Matthew, Emily, Megan, and Casper, as well as the Upper Midwest Agricultural Safety and Health Center, which provides funding for this project through a cooperative agreement from the National Institute for Occupational Safety and Health. I'd like to start with providing some background on the Rural Firefighters Delivering Agricultural Safety and Health Project, also known as RF-. Previous research has identified local firefighters as a resource to include in the design and implementation of farm safety programs. Agricultural community members were asked to identify a trusted source of information they would go to in their community. One of the individuals that emerged from that analysis was local firefighters. And so RF- leverages that information and designed a training program which is to equip rural firefighters and EMS personnel with agricultural health and safety knowledge. This training program includes two components, a 4-hour classroom training and a 4-hour hands-on experience at a local farm. The training includes topics on farm first aid, farm hazard analysis using saferfarm.org, as well as Farm Mapper. The aims of the training are twofold. The first is to establish a network of firefighters and EMS professionals committed to agricultural health and safety. And the second is to have trainers disseminate health and safety interventions in their local communities. The current study presents a developmental evaluation of ongoing study efforts, or program efforts. So the RF- program is ongoing. And this study represents data analysis to inform future program efforts within RF-. So the first research question is built on the aim 1 of the RF- program. Is a network of firefighters and EMS professionals trained by RF- emerging? The second research question is built off the second aim of RF-, and it's are trainers able to disseminate RF- in their communities? To answer these questions, we utilized a subsample of 23 trainers who completed one of two of the trainings held in Wisconsin. So this includes 15 men and 8 women. Importantly, the 23 individuals comprise our network. So they are the core of our network, all 23 of them, regardless on if they provided information on the social network analysis interview. So social network analysis interviews were scheduled for 12, 18, and 24 months following training. At this time, we have 14 individuals who have completed the Time 1 interviews. This includes 10 men and 4 women. When looking further at the sample, their field experience or the amount of time they spent as a firefighter or EMS professional has a big range from being new in the field to 44 years of experience, with an average of 17 and a half years about. The social network analysis interview included a number of questions on who they've contacted and been in communication with or trained regarding RF- and agricultural health and safety. So some sample questions include who have you contacted to get facts, information, or skills related to firefighting and EMS in the last 3 months? Who's contacted you for facts, information, or skills related to firefighting and EMS in the last 3 months? And who have you trained or engaged with in the RF- program in the last year? So these are a sample of questions. Individuals were provided the interview guide, and it was designed to be more of a worksheet type of guide that included open space for individuals to write down names and organizations of who they've connected with. During the interviews, which either took place in person or by phone, depending on the preference of the individual interviewed, individuals were asked to bring that sheet with them, as well as we followed up with individuals if they weren't able to identify an individual in their interview. So if they said like, oh, I worked with this person, but I can't remember their name. I know their last name begins with like a N, but I can't think of their full name. We would follow up with them to see were they able to get their full name. The interviewer may also have waited to say, like if they were like, oh, it's in my phone, we would have said, oh, do you want to get it out right now, and provide that information in order to have as complete a picture of the network as possible. So in looking at results, research question 1, this is there a network of trainers at 12 months post-training? So is this network established? Is it and emerging? So this represents the picture of the network. The squares represent individual trainers. So again, I mentioned we would include all 23 individuals regardless if they completed the social network interview. Individuals in blue are the individuals that have completed the social network analysis interview. Gray individuals are the individuals who have not completed that interview. The lines represent connections, so or tie between the individuals. So either this individual or this individual mentions connecting with each other. So as a result, we have 11 ties throughout the 23-person network. We have a density of 0.04, which means we have 4% of the total ties possible within the network, and an average degree of 0.48, which means we have about each person is connecting with about a half of another person. So as we look forward to the 18th and 24-month post-training interviews, we would hope to see these numbers grow. And thinking longitudinally what we'd like to see. We'd like to see greater ties, greater density, greater average degree. In looking further at the network picture, because this can tell us a lot of information, but we also want to know, like, well, what is it about these two individuals that are connecting? When we look further at the network, we can tell that the individuals who are connecting are generally within the same department. So it might be that these two individuals are in the same firefighter department, or it represents a firefighter or an EMS individual within the same community. So they're geographically close and maybe had a existing relationship prior to the training, although that's unknown if there was a prior relationship. But it's geographically close within the same department or within the same community. So what that means for RF- moving forward. RF- moving forward is engaging in activities to further build this network. So further connecting trainers. Two specific examples of the activities that RF- is engaging in. One is sharing a trainer list. So providing a trainer list. Here are the individuals who have been trained with RF-. Here's their contact information if you want to reach out and connect with them about their experience or what they're doing within their communities, and kind of facilitating that connection. Another aspect that RF- is focusing on to further these connections is doing spotlight stories. So highlighting the work that individuals are doing within their community and encouraging others to reach out and connect with them about questions they may have, resources, what was helpful for them in doing that within their community. So providing that contact information and encouraging that connection through spotlighting what it is other individuals are doing. Research question 2 is, are trainers able to disseminate that information and interventions within their local communities? So this picture looks a little different. So I'm going to take some time to explain it and then go through statistics and implications. So instead of blue squares and gray squares, the 23-member network of trainers is represented by red circles and gray circles. So red circles are the individuals who have completed the social network interview. Gray circles are the individuals who have not completed the social network, or trainers that have not completed the social network interview. The squares are individuals outside of the network of trainers that have been reached, okay, so or connected with through any means. The individuals on the outside are individuals that they have trained or talked with or have conducted an intervention with regarding RF- and egg health and safety. Individuals within the inside are individuals that they're going to for information and kind of knowledge outside of the network, but reaching and connecting to for information. So when we look at this, we have 436 ties, which includes the ties inside the net, like within the network, but then also the external ties. We have a density of 0.08, or 8% of the total network connections, and an average degree of 1.198. When we look at this picture, density and average degree really don't mean that much to us because we're not going to each of these squares or each of these individuals and asking, have you connected with everybody else, or have you connected with these individuals further? So that is a limitation. We're not connecting with the individuals that the trainers are saying they're connecting with. We're just connecting with these core 23 individuals. From this picture, a number of questions have emerged. So one, we know that people are successful in reaching out into their own community. We have varying success. So one of the questions and reflections that the group has been thinking about is, well, what makes that difference in the amount of connections and who they're connecting with, which is the second thing that's really prompted is, well, who are these individuals within a community that they're reaching out with? What is their role? And so we went back and coded each individual with a role within their community. So the purple squares represent individuals within the education system. So it's either instructors, uh, individuals taking courses within the communities, or institutions themselves. So it might represent an educational institution within a community. Yellow represents the community, kind of general community. So it might be something like an open house. It might be something like a town chairperson or individual organization within a community, such as FFA or 4-H. The blue represents fire and EMS personnel. Okay, so each of the blue squares, they're either somebody within the fire department or EMS department in the community. Brown represents the farmers within the community, so either reaching out and connecting and talking about RF-, going out and doing something like a farm hazard analysis with them. And then the green represents RF- team members. So what we can tell from this picture is that RF- trainers are disseminating information. They're primarily dissemination to fire and EMS personnel, followed by individuals within the education system. So one of the things that we talked about is who's not being reached by this picture. So we can look at this and see, wow, we're really reaching fire and EMS. Is that the same target population that we had at the beginning of the program through the training, through now that the trainers are out there connecting? Are those in line and in sync? So we can raise those kind of questions. We can also see who's not being reached by trainers, what communities maybe aren't being reached, and further questions like that really prompt a lot of discussion. So I want to leave you with some conclusions today related to this project. And we know that RF- is reaching communities. In a developmental evaluation approach, we think about, well, where can we be turning attention to? What does it look like in terms of who are we reaching? What is the network looking like? And so we can really focus on asking these questions and reflecting on how do we increase network building within our population? And then who is our target audience? Who do we want this to be in terms of reach within communities? One of the main limitations of this study is the missing data. So we have 14 of the 23 individuals completed data at time 1, which presents an incomplete picture. We don't know why that information is missing. We don't know if it's because they're too busy. We don't know if it's because they haven't done anything with the RF- program. We really don't know anything about why that data might be missing. But what we are doing is continuing to follow up with them and encourage participation in the social network analysis. So through things like the RF- constant contact, we're highlighting, this social network interviews are important. Here's what we're finding based on of them, and why your information is important and how it's being used, because sometimes that can also be a limitation for individuals not knowing, well, you're wanting to know who I'm connecting with, why, and building that trust through communicating, this is what we have found and how it's being used to inform project activities. So an important aspect is this presents a baseline assessment of the network at 1 year post-training. We will look again at 18 months and 24 months to assess for changes. So one of the really great things about social network analysis and doing it longitudinally is you can look for it how the network changes over time. Where do we see growth? Maybe where do we see not as much growth or limited growth, and holes within the network. So that'll be a really interesting thing to continue to do as a group, and as a project together. And the last thing that I want to leave you with is that social network analysis is a great tool for monitoring programs, and providing that developmental kind of evaluation, context. Here's some data to look and reflect on of, and especially a visualization of that data of how our project is doing. And it really provides some great, evidence-based information to prompt reflection, and further assessment of the project as it's ongoing. So I'd love to answer any questions that you have. My contact information, my email and phone number are on the first slide. You can also reach out to the National Farm Medicine Center with any questions, for me or about the larger RF-project. And please connect with us on social media. Thank you.